Hello, and welcome to Doc Talk with me, Dr. Rick Rios. Today we're going to talk about x-rays, digital x-rays. Every day I see people who ask me, do I really need this x-ray? People are savvy these days and they're very concerned about radiation exposure. I totally get it, rightly so. Radiation's scary and I wouldn't want any unnecessary radiation. But first, let me state that in my office, you will never be forced or shamed into having anything done that you don't feel comfortable with. Okay, I just want to lay that out on the table. That is my promise. The bottom line is, if you don't want an x-ray in my office, you don't have to have it. But I think it's important for me to outline some very compelling reasons why you may want to allow us to take your x-rays. Okay? Number one, x-rays are the only way that I can see through the gums, the bone, into the roots and the nerve chambers of the teeth. It's the only way. Number two, without an x-ray, I have less than 50% of the information that I would need to make a proper diagnosis. So if I don't take an x-ray, chances are that I'm going to miss something that's going to cause you pain later on. It's not my tooth, it's your tooth. There's been many times when we've caught a cavity that's just getting started just because we took an x-ray, whereas if we had waited even 6 months or a year later to take the x-ray, it probably would have gotten into the nerve and caused a root canal. So that's why it's important to update x-rays. Now, I've equipped my office with digital x-rays, and our system takes the same picture that a standard x-ray film does, except it does it with 90% less radiation. So you get more exposure to radiation from walking through the automatic sensor at the doors at Target than you do than being out, and you get about 1,000 times more just being out in the sun for an hour than you do by getting one x-ray taken. So you can kind of put the radiation question in perspective. So, 4, with a digital x-ray, I can blow up the image this big. So I can see it about 100 times bigger than like the old standard x-rays that we used to take years ago. There's also different ways I can enhance this film. Like I can hit a revealer which sharpens the contrast. I can even make it in colors. But it's really cool and it helps me to see a lot better than I used to be able to 20 years ago. We also follow the guidelines put forth by the American Dental Association in terms of frequency of exposure. So I just want to speak from the heart. I just believe with all my heart that dental x-rays are safe and effective. And I hope this helps to answer your questions and concerns. Thank you.